Hello again, this is Dr. Halbert here in the office of Parkrose Chiropractic on Northeast Sandy. Today I'm going to talk to you a little bit about the critiques of chiropractic healthcare. There are some folks out there who want you to believe that chiropractic is a pseudoscience and there's nothing more to it than placebo. On that topic, please see my last video on your relationship with your own healthcare to see why I think placebo is actually pretty darn awesome. But right now, I want to talk about chiropractic care. Now, there was a time when all we could say was, look at how many people we've helped, or how many of our patients swear by the healthcare we provide. But some people just don't want to believe it. One recent article is a good example of the criticisms. It claims chiropractic is based on a delusion, and that we don't deserve to be accepted as doctors or even legitimate healthcare providers at all. These defamatory articles typically go on to suggest that chiropractic adjustments are useless, not supported by real science, and very dangerous. I see this kind of thing all too often, and I want to address it. First off, medicine evolves over time. Year after year, doctors and researchers do their best to hone the healthcare we provide based on the best possible information and clinical experience. So bashing any medical system based on what it thought or did 100 or more years ago is not a very relevant criticism today. There's a reason MDs don't as frequently perform leeching or believe that a woman's uterus travels freely about the body, causing hysteria. But the old doctors did get some things right. Many MDs today still swear to some version of the Hippocratic Oath. Hippocrates, the father of medicine, was pretty on point with some things like do no harm, let food be thy medicine, and when in sickness, look to the spine first. We've come a long way, and chiropractic care actually has a lot of good research now, and more all the time, often showing it comparable to or better than traditional Western medicine therapies for some important conditions like disc herniation and low back pain. For example, one systematic review shows that 5 to 10 sessions over 2 to 4 weeks achieves equivalent or superior improvement in pain and function at short, intermediate, and long-term follow-ups when compared with other commonly used interventions like physical modalities, medication, education, and exercises. Now, of course, you can find faults with some of these studies, but that's true of any and all research. It's more expensive than you might believe and very difficult to fund any research when its results aren't going to make a pharmaceutical company many millions of dollars. A research issue specific to hands-on treatment like chiropractic is that it's easy to make a sugar pill. It's very difficult to make a non-therapeutic fake adjustment convincing enough that a participant wouldn't know the difference. It's even harder to have a properly trained and licensed chiropractor deliver that fake adjustment without knowing they did. These differences can make it even more tough to produce research people can't question. Nevertheless, enough decent research has been done that the prestigious Mayo Clinic's website admits chiropractic adjustments can be effective in treating low back pain, further stating that spinal manipulation also may be effective for headaches and neck pain. The big hammer people like to throw is the highly publicized risk of stroke from cervical adjustments. Of course, there are actually numerous risks to chiropractic care, just like any other treatment, including physical therapy, medication, surgery, or no treatment at all. One defamatory website said that the risk is so unacceptable that if a chiropractic adjustment was a drug, it would have been pulled off the market and then promptly called for a ban. Luckily, I don't think this particular author works for the FDA because his risk-benefit analysis completely ignores the data. It takes about 5.85 million chiropractic cervical adjustments to have one of them associated with stroke. So, it can happen, and I take that risk very seriously. That being said, according to the CDC, every day in the United States, 44 people die as a result of prescription drug use. And that's only counting the opioids. Don't get me wrong, medications are an important tool in healthcare, but as it turns out, chiropractic care is actually very safe comparatively. When all else fails, the last-ditch effort to defame the profession is this: people get better anyway without any treatment at all. Well, that is true sometimes, but with that logic, why target chiropractors over pharmaceuticals, MDs, or anything else? Sadly, while most people do heal to some degree, many have recurring flare-ups or have to deal with chronic pain for years, and I believe few actually ever truly reach pre-injury status. If you've ever had a serious injury as an adult, you know just how true that is and how frustrating it can be. Studies show anywhere from 33 to as high as 70 to 80% of individuals continue to have low back pain 1 year after the initial onset. So, while it would be great if humans didn't need healthcare, that's just not the case. The reality is chiropractic care is a very important part of the larger healthcare system, which ideally helps people resolve, improve, or manage their conditions. So I urge all healthcare providers to please work together for the benefit of all patients. And as a patient, being informed about the healthcare you receive is essential. Just make sure the information is a realistic representation of the facts. When it comes to the health of you and your loved ones, you should have access to a good chiropractor, MD, surgeon, masseuse, psychologist, acupuncturist, or any other practitioner that helps you heal and make it through the day. So as always, forward this to anyone you know who might benefit from it, and check back in a week or two for more. Thank you.